Welcome to our educational program. This is Module 3, and this is by myself, Samantha Dittmer, and Brittany Hartman. So for postpartum depression, last week we learned that depressive symptoms will last beyond the 2-week period to be diagnosed with postpartum depression. The baby blues will occur within those 2 weeks. Postpartum depression can have a negative effect on the body rather than just mental. So you could experience physical symptoms such as increased inflammation or have more chronic diseases. Fathers can experience a form of postpartum depression, which we call paternal postpartum depression. And women can be reluctant to seek care due to stigma or just being unsure of who to go to for help.
Last week, I discussed feeding milestones. So the timing of developmental milestones varies greatly throughout development. For example, from 30 to 36 months and beyond, you can expect certain milestones such as your child setting the table, maybe using a napkin while they eat. There are also various feeding milestones a child will meet throughout the first 36 months. I went over these as well. And these stages help a baby slowly build up to solid foods.
So in this segment, we'll be discussing postpartum psychosis and intrusive thoughts. So what is it? Psychosis means to lose touch of reality. And this is what women will experience when being diagnosed with postpartum psychosis. This is the most severe psychiatric illness. Episodes that women experience can represent that of bipolar disorders and change between manic and depressive episodes. The symptoms of postpartum psychosis rapidly evolve and require urgent attention for the safety of themselves and others. So someone experiencing this may come off as having mild symptoms, and those symptoms can go from mild to very severe very quickly. So how common is postpartum psychosis? Psychosis will occur in 1 to 2 out of 1,000 births, so it is pretty rare. Onset is usually within the first 2 weeks after delivery, but symptoms can appear as soon as 24 to 48 hours after birth. So what are some symptoms or clinical features of psychosis? So we have hyperactivity, maybe being more agitated or on edge, bizarre or disorganized behavior, trouble sleeping, having delusions and hallucinations, so maybe they are seeing things or hearing something, but they believe that these delusions and hallucinations are true. They have poor concentration, a flat affect, which is maybe no expression, almost looking or feeling numb, and delusions of control or doing harm to the baby or themselves. So there can be many different causes of postpartum psychosis, but a main cause is thought to be because of hormonal changes, and stress and big life changes can also increase the chances of onset. So kind of in other diagnoses that I've talked about, hormones play a big part of it, but maybe having a big life stressor can affect it as well. Other features that may affect it are being pregnant for the first time, having your first baby, having an unplanned pregnancy, big mood swings before and after pregnancy, and also the starting and stopping of medications can produce the symptoms of psychosis and also throw off that hormonal balance. So what makes you more susceptible to possibly being diagnosed with postpartum psychosis? We want to look at previous bipolar episodes, psychosis, or postpartum psychosis. So having this in the past before this pregnancy. Of course, a family history of psychosis or bipolar disorders, sleep deprivation, perinatal infant mortality, so the baby dying in utero, complications during labor and delivery, having a lack of partner support, and also increased environmental stress. So I thought this was a good one to bring up because a lot of the parents in EI do have a child that has a delay or a diagnosis, and this is one of those environmental stressors. So having therapies and doctor's appointments and just the overall worry about your child could increase that environmental stress. So I thought that was a good point to bring up. So I found some good personal stories from women who have had postpartum psychosis. I believe psychosis is one of those things that it's really hard to wrap your head around if you've never experienced it. So I like these personal stories. So the first one was, I was certain that my husband, who really is one of the world's greatest men and husbands, was out to get me. I thought he wanted to divorce me and take our child. I thought he was probably sabotaging our efforts to get help. This man, who I trust more than anything in the world, I felt I could not trust. The second one is, if I'd known about it, postpartum psychosis, I'd probably have, I'm not saying it would have stopped it, but it probably would have helped me understand a little, thinking this is what I'm having. Because obviously if you've never heard of anything, you go off your rocker, you think, my God, what is wrong? So I like this one because she's kind of explaining the purpose of why I thought it was important to teach about these different diagnoses. Even just that being more prepared for what may happen and educating yourself on what you may experience. I believe knowledge is power, and if this woman would have been more educated on what she was experiencing, she would have been able to recognize the symptoms and get help a little bit quicker. The third one is, I feel that people often think it's postnatal depression, and they don't understand it at all. It's taken me 20 years of really banging my head against the wall trying to make people aware of it. So right there, that's why I talk about decreasing stigma, and if you are experiencing symptoms or this diagnosis, it is important to talk about it because it teaches other people that, hey, it's okay. This might be something I'm ashamed of, but I shouldn't be. So the lack of awareness by professionals and peers prevented women from seeking and gaining support, and they left women feeling as though their symptoms were minimized or dismissed. So I also think this is important to talk about because bringing up awareness also decreases the stigma. So being aware of what may present after birth can make women feel a little bit more comfortable, and it also helps professionals as well as peers understand what these people are experiencing a little bit more. So next I want to talk about intrusive thoughts because it is something a lot of people experience, but they might not know exactly what they are. So in the video above, she talks about having disturbing thoughts about her children. So those might be called intrusive thoughts, and those are a big feature within postpartum depression and postpartum psychosis. They can be a comorbidity of many kinds of mental illness, and even without having a mental illness, people experience intrusive thoughts. They can be thought of as mental events that interrupt the flow of task-related thoughts in spite of efforts to avoid them. So a lot of intrusive thoughts can be about doubt, decisions, identity, safety, death, and religion. So intrusive thoughts are a normal human experience. They can be heightened during postpartum and can be a comorbidity of many maternal mental health conditions, especially psychosis. So intrusive thoughts can affect 70 to 100% of new mothers and is typically experienced by 80 to 99% of the general population. So even those that are not postpartum or do not even have a mental diagnosis can experience these disturbing thoughts. The height of the thoughts they'll begin within the first couple weeks after giving birth. So what are intrusive thoughts typically about? Intrusive thoughts are unwanted and generally unpleasant to have. Half of new mothers report that these thoughts include thoughts about harming their baby, and these tend to be the most upsetting ones. 83 to 92% of these thoughts tend to be about general accidents occurring. 53 to 59% include thoughts of contamination and illness, and intentional harm tends to be 32 to 46%. It is important to remember that although these thoughts are upsetting, they are common in those that don't even have postpartum period. It is outside an outside support person, it is important to ask questions to those that might be experiencing these thoughts. If you have an indication that the baby is in harm, it is important to receive help immediately. In most cases, mothers do not want to act on these thoughts, but in a severe case such as psychosis, a mother may have feelings of wanting to act on the thoughts. If you are having difficulty identifying if what you're thinking is an intrusive thought, you can try to ask yourself these questions. Is it a usual thought? Is it bothersome? Does it feel hard to control? When you are having these thoughts, it is best not to fight them. It is best to learn to let the thought come and go. Thinking about the thought will only lead to you thinking about it more. This can lead to compulsions and OCD type behavior. Instead, you can say things to yourself such as, "This is intrusive. I have no control over this thought. I will not act on this thought." Do not try and fight the thought. Do not judge yourself for having the thought. It is a normal occurrence that everyone experiences at some point in time. If you or someone you know is experiencing postpartum psychosis or intrusive thoughts that interrupt their daily life, please seek help from a therapist or a doctor as soon as possible. It is important to keep in mind that these thoughts do not need to be discussed in detail, but it is important to be aware of the issue. Reach out to your therapist if you are in need of resources. So I have a little knowledge check here. What symptom differentiates postpartum psychosis from other types of postpartum mental illness? A. Sadness, B. Insomnia, C. Mood swings, or D. Delusions and hallucinations? The answer is D. Delusions and hallucinations. So here are some resources. If you or someone you know has been affected by postpartum psychosis, Postpartum Support International has different support groups. A general support group is held every Monday at 7:30, and support groups for families is the first Sunday of every month at 6:30 p.m. I have the links posted here if you would like to copy them down, and you can also find the groups by going to postpartum.net and typing in postpartum psychosis help in the search bar.
My topic today is about breastfeeding. If this topic does not directly relate to you, please still stay open to the information, as it could help a family member or friend, or help you in the future if you decide to have a baby. By the end of my presentation, I hope you'll understand the benefits of breastfeeding. I hope you'll recognize when a baby is properly latched. I hope you'll be able to determine if a baby is getting enough milk. And I hope you'll know where to find help and support with breastfeeding. To start off, I wanted to share some important breastfeeding facts and statistics. So 3 out of 4 mothers, which is 75% of mothers in the US, start out breastfeeding. At the end of 6 months, breastfeeding rates fall to 43%, and only 13% of babies are exclusively breastfed. Among the African American population, the rates are significantly lower. 58% of mothers start out breastfeeding, and 28% are still breastfeeding at 6 months, with 8% exclusively breastfeeding at 6 months and beyond. The Healthy People 2020 objectives for breastfeeding were 82% of babies were breastfed ever, 61% at 6 months, and 34% at 1 year. There are many benefits to breastfeeding. Breastfeeding protects against a variety of diseases and disorders, including respiratory tract infection, ear infections, urinary tract infections, type 1 and type 2 diabetes, leukemia, childhood obesity, and diseases of the gut, and more. There are immunological benefits of breastfeeding. Human breast milk neutralizes infectious agents in the body. It inhibits growth of many types of bacteria. Breast milk reduces the risk of infants developing eczema, and it also enhances an infant's immune function. Benefits to breastfeeding also includes a decreased risk of the baby developing SIDS, and according to a study published in the Journal of Pediatrics, any breastfeeding from 2 to 4 months reduces the risk of SIDS by 40%. Any breastfeeding from 4 to 6 months reduces the risk of SIDS by 60%. and any breastfeeding 6 months and on reduces the risk of SIDS by 64%. Breastfeeding also promotes secure attachment. Breastfeeding appears to promote sensitive responsiveness of the mothers and attachment security of infants. Hormonal benefits as well include reducing stress, having a calming effect on the brain, and breastfeeding has been shown to reduce a mother's risk of postpartum depression. Also, hormones found in breast milk have a protective effect against obesity. Physical benefits for the mother also include a decreased risk of breast and ovarian cancer. Breastfeeding decreases the risk of postpartum bleeding, and it also includes an earlier return to pre-pregnancy weight. Breastfeeding also encourages optimal oral motor skills and development for your child. So what can occupational therapists do to help you during breastfeeding your child? So we can help establish new habits and routines and help you manage your time. We can assist with positioning and attachment. We can educate and provide resources as well in regards to breastfeeding. We want to support the care of the mother, the infant, and the family as a whole. We set realistic expectations. So if breastfeeding is not working out, we will trial and error and try everything we can to help you be able to breastfeed your child. But we also realize that breastfeeding may not be realistic for you, and we can help set up alternatives as well. And then we also want to help form positive coping strategies and increase your self-efficacy, which is the belief that you can do this. You can breastfeed your child, take care of your child, and be a great mom while managing your time. So one thing I mentioned in the previous slide is occupational therapy can help with positioning and attachment during breastfeeding. Breastfeeding is a skill that you and your baby learn together, and it takes time. So if you need help, that is okay. There are so many different breastfeeding positions you can try. You first want to make sure you're comfortable. It's worth getting comfortable before a feed. Use pillows or cushions if necessary, and your shoulders and arms should be relaxed. You also want to make sure the baby's head and body is in a straight line. It's hard for your baby to swallow if their head and neck are twisted. You want to hold your baby close to you, facing your breast. Support their neck, shoulders, and back, and this allows them to tilt their head back and swallow easily. Always bring your baby to the breast and let them latch themselves. Avoid leaning your breast forward into your baby's mouth, as this can lead to poor attachment. Your babies need to get a big mouthful of breast. Placing your baby with their nose level with your nipple will encourage them to open their mouth wide and attach to the breast well. Try not to hold the back of your baby's head so that they can tip their head back. This way your nipple goes past the hard roof of their mouth and ends up on the back of their mouth against the soft palate. After you and your baby are in a comfortable position, the next step is latching your baby. Hold your baby close to you with their nose level with the nipple. Let your baby's head tip back a little so that their top lip can brush against your nipple. Help the baby make a wide open mouth. When your baby's mouth is open enough that their chin should be touching your breast first, with their head tipped back so that their tongue can reach as much of your breast as possible. With your baby's chin firmly touching your breast and their nose clear, their mouth should be open. When they attach, you should see much more of the darker nipple skin above your baby's top lip than below their bottom lip. Your baby's cheeks will look full and rounded as they feed. Some of you may be visual learners like I am, so on this slide I have a video on how to know if your baby is properly latched. Sometimes breastfeeding is very difficult, and that could be because the baby has something going on internally or externally. So one thing that the baby might have is a cleft lip or palate. The palate is more commonly referred to as the roof of the mouth, and this separates the mouth from the nose. The palate is important for feeding and speaking. A cleft is an opening or split in the palate. This cleft can make feeding hard for your baby. Most babies with a cleft of the palate are not able to use standard bottles or solely breastfeed because they cannot create the suction needed to draw the milk out of the nipple. Special bottles and nipples are available to help infants with cleft palate feed and grow. These bottles may be used with formula or breast milk. The bottles are pictured on the slide. I have the nurser in picture 1 and the Medela in picture 2. Tongue tie is another factor that can make breastfeeding difficult. So how to identify tongue tie? The tongue attaches to the floor of the mouth with a web of tissue called the lingual frenulum. The frenulum typically gives the tongue more stability, but in cases of tongue tie, it can restrict the tongue's movement. When your baby tries to lift their tongue or move it forward, it may appear misshapen, short, or heart-shaped, with the frenulum clearly pulling its center down and restricting its movement. This is a sign of tongue tie. Or you may be able to see or feel firm tissue where your child's tongue meets the floor of his mouth. Degrees of tongue tie vary, and it can be difficult to diagnose accurately. A short, tight posterior tongue tie is rarer and may be particularly hard to spot. So how breastfeeding might be affected? Tongue tie affects tongue movement to varying degrees. The shorter and tighter it is, the more likely it is to affect breastfeeding. Some babies with a tongue tie breastfeed well from the start. Others do so when positioning and attachment are improved. But any tongue tie that restricts normal tongue movement can lead to breastfeeding difficulties. A baby needs to be able to move his tongue freely and extend it over the lower gum with their mouth open wide to be able to breastfeed well. The symptoms listed are all associated with poor attachment that may be caused by tongue tie. So a baby may be unable to latch on the breast at all. They may be unable to latch on deeply, causing nipple pain and damage. They may have difficulties staying on the breast and making a clicking sound as they lose suction. They may splutter and choke when coping with fast-flowing milk. They may breastfeed constantly to get enough milk. They may have poor weight gain or need supplementation to maintain adequate weight gain. They may develop jaundice that needs treating. They may be fussy at the breast when the milk flow slows, and they may develop colic. Consult your doctor if you expect your child has tongue tie, and your OT can also help with this as well. As stated in the previous slide, the types of tongue ties vary in degrees. So type 1, the frenulum is thin and elastic, and type 2, it's fine and elastic. In type 3, it's thick and stiffened, and in type 4, it's posterior, which means towards the back of the mouth, or it's not visible at all. So pictured is kind of the degrees of tongue tie from worse to more minor. So what else makes breastfeeding difficult? Lip tie can also affect breastfeeding, and it varies in degrees as well. So lip tie occurs when the membranes in the frenulum, the piece of tissue that is directly behind the upper lip, are too thick, keeping the upper lip from moving as it should. Class 1 of lip tie involves minimal visible attachment. Class 2 is attachment where free and gingival tissue meet. This is tissue that covers the bone of the jaws and teeth. Class 3 inserts in front of the anterior papilla, which is the tissue on the tongue. And Class 4 is attached into the hard palate and anterior papilla area. There's also a type of tie called cheek tie, or it's known as buccal tie as well. This tie occurs when the cheek has extra tissue connecting the gums to the inner cheek area. High palate can also cause breastfeeding issues. High palate is when the palate is narrow and tall at the roof of the mouth with the tongue resting flat on the floor of the mouth. This is very common in babies and can be present at birth. It can develop after birth as well due to excessive thumb sucking and pacifier use. It can affect breathing, feeding, sleeping, and speech. It may resolve on its own, Or you can work on tongue repositioning exercises to help strengthen and reposition the tongue. OTs can help with this as well. If the high palate is causing no problems in infancy but begins to trouble your adolescent, consult a dentist or orthodontist because your child may need a palate expander. Surgery can also be done if needed, but again, this would be done by a dentist or orthodontist. And this is when your child is in adolescence. This is not in the birth to toddler years. Attached on this slide is the degrees of lip tie and how they look differently based on their classes. So now I'm going to answer some common questions when it comes to breastfeeding your child. So the first question is it okay to nurse a baby for comfort? If your baby seems to be getting enough milk but continues to suck for an hour or more, your little one might be nursing for comfort rather than nourishment. This is called non-nutritive sucking or pacifying. So how do you know? A baby that is fed well may stay on the breast but seems satisfied, stop sucking and swallowing, and they may begin playing with your nipple. If you notice this happening, you may want to offer your baby's thumb or hand to suck on. You also could consider giving them a pacifier, but only if breastfeeding is well established, so after your baby is 3 to 4 weeks old. The next question is, baby doesn't want to nurse, so what's going on? So babies may stop nursing and go on a strike for many reasons. Something might be making your baby uncomfortable, such as sore gums from teething, an ear infection or mouth infection, or even a stuffy or runny nose. Other reasons might be because you smell different by trying a new soap or perfume, or if you've changed your diet and your milk tastes different. Whatever the cause, you and your baby can get over this temporary hurdle. Here are some tips. Make the experience as enjoyable as possible for your baby. Praise them, caress, and kiss your little one when stopping to comfort whenever he or she gets upset or frustrated. Nurse when your baby is sleepy. They may be more willing to cooperate. Make sure there are no distractions. Stimulate your milk letdown by hand expressing or pumping before breastfeeding so your baby can get the milk right away. And nurse while you're rocking your baby or walking around while carrying your little one in a sling. Breastfeeding strikes are normal and many last only a few days. Until your nursing schedule is back to normal, pump or hand express to keep your milk supply up and to make sure the baby gets enough to eat. When your child is really ready to stop breastfeeding or wean, they'll probably do it over a period of weeks or months. And again, you can talk to your doctor or occupational therapist to help with this. Another question is it normal to feel pain during or after breastfeeding? So when babies latch on properly, some moms feel a few moments of discomfort at the very beginning of a nursing session. After that, the discomfort should ease. You may feel a gentle tug on your breast while the baby feeds, but it shouldn't hurt. If you feel discomfort during nursing, stop nursing and reposition your baby to get a better latch. Your nipple should be mostly in your baby's mouth. And when babies are latched on wrong, it can hurt or feel like a pinch each time your baby sucks. So over time, this can lead to painful, sore, cracked nipples. If you have pain during breastfeeding, talk to your doctor or lactation consultant or OT to make sure your baby is properly latched or that something else isn't going on. So the last question is, what causes a low milk supply during breastfeeding? Various factors can cause a low milk supply during breastfeeding, such as waiting too long to start breastfeeding, not breastfeeding often enough, supplementing breastfeeding, an ineffective latch, use of certain medications, sometimes previous breast surgery after milk production. Other factors that can affect milk production include premature birth, maternal obesity, pregnancy-induced high blood pressure, poorly controlled insulin dependent diabetes. So although many women worry about low milk supply, insufficient breast milk production is rare, and in fact, most women make 1/3 more breast milk than their babies typically drink. So to boost milk production, breastfeed as soon as possible. Waiting too long to breastfeed can contribute to a low milk supply. Hold your baby skin to skin right after birth, and your baby will be likely to breastfeed within the first hour after delivery. Breastfeed often. So for the first few weeks, you want to breastfeed 8 to 12 times a day, about every 2 to 3 hours. You want to also check your latch to make sure your baby is latched in position well, and look for signs that your baby is swallowing. Be alert to feeding problems. Offer both breasts at each feeding. It's okay for your baby to nurse on only one breast at a feeding occasionally, but if this happens regularly, your milk supply will decrease. You might pump the other breast to relieve pressure and protect your milk supply until your baby begins taking more at each feeding. And don't skip breastfeeding sessions. Pump each time you miss a breastfeeding session. Hold off on the pacifier. If you do choose to give your baby a pacifier, consider waiting until 3 or 4 weeks after birth, so this gives you time to establish your milk supply. Also, use medications with caution. Certain medications can decrease milk supply, and avoid alcohol and nicotine use as well. So I know I just threw a lot of information at you. Take it in and replay this slide if needed. So a knowledge check question I have, it's a select all apply. So what are some benefits to breastfeeding your child? A, breastfeeding protects against a variety of diseases and disorders. B, breastfeeding decreases the risk of sudden infant death syndrome, SIDS. C, breastfeeding has hormonal and physical benefits for the mother. Or D, breastfeeding encourages optimal oral motor skills and development for your child. The answer is all of them. A, B, C, D, all apply. On this slide, I have some breastfeeding help and support that you can get if you need help and support with breastfeeding. The first one is the National Women's Health and Breastfeeding Helpline, and I have a number here on the slide for you for the United States. Group breastfeeding support sessions with OT, lactation consultants, or other professionals are also available. So you can look online or in your area for these sessions. Online social support groups on Facebook and Instagram are also available. So again, look for these groups and join them if you need the help and support. And then speak with your doctor or occupational therapist as well. I have some additional resources from the CDC website. These are fact sheets that can also help with breastfeeding. I will provide links in the comments as well. If you have any questions or stories you'd like to share, please feel free to put those in the comments.